Hi, this is Dr. Brian Hoh. I am professor and chair of the Lillian S. Wells Department of Neurosurgery at the University of Florida, and I'm currently president of the Congress of Neurological Surgeons. You are listening to Interview with the Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Brian Hoh, Chair of Neurosurgery at University of Florida and the current president of the Congress of Neurological Surgeons. Doc, how are we doing today?
Great. Thank you, Matt, for having me.
Thank you so much for being with us. So getting this started, what were your goals and aspirations during your residency and how those changed throughout your fellowship?
Yeah, when I was a neurosurgery resident, I really had dreams and aspirations to be an academic neurosurgeon, to be a clinician scientist. And I had excellent role models and mentors in medical school and then in residency. I really looked up to them and wanted to follow in their footsteps. And so I really had this dream that I would be just like them. I would be an academic neurosurgeon with a research laboratory, specializing in cerebrovascular neurosurgery, training fellows and residents, but also being a scientist and doing research to push the field forward.
So kind of taking us through that last year, what was your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
I had always wanted to be an academic neurosurgeon, and I didn't really look into or consider a private practice career. But at the time that I was looking at job opportunities, this was 2004. I was graduating in 2005. And at that time, I had completed a endovascular neurosurgery fellowship. And so if you think about it, this is 17 years ago. There were very few, just a handful of us neurosurgeons that had completed endovascular training. And many academic departments across the country, academic neurosurgery departments, wanted a endovascular trained neurosurgeon on their faculty. So I was very fortunate with the timing of things and me being in that position that there were many opportunities out there for me. I think that it's very different now. I think that there are many endovascular trained neurosurgeons, but at the time there were many opportunities. So I just sent out letters to the 20 departments in the country that I was very interested in. And your question's a very interesting one. When I first started and sent out those letters, I had an idea of where I wanted a job, and a lot of it was geographically based. At the time, I had done my fellowship and training in Boston, and my girlfriend at the time, who is now my wife, I think we really kind of were just looking at the Northeast and considering either Boston or New York or Philadelphia. I had looked at a job in San Francisco as well, but then your question is, how did things change as the process went along? After I had looked at some places in those areas, I received a phone call completely out of the blue from Bill Friedman, who was then the chair of neurosurgery at the University of Florida, asking me to take a look at an opportunity here in Gainesville. I remember at the time thinking, there's no way that I would move. At the time, I thought, Gainesville, Florida is the South. And I remember telling my girlfriend at the time, she's now my wife, I'll just take a look. There's really no chance that we're going to move down there. And when I came, I was just completely blown away, impressed by the institution, the department, the opportunities here. It was exactly everything that I had wanted in an academic career, except I didn't know anything about Gainesville, Florida. And so at the time I thought, I'll just really sacrifice geography or living in a big city or living in the Northeast for the academic opportunity. I told my girlfriend, who's now my wife, I told her, we'll move down there for 3 to 5 years. I'll establish my academic career, and then we'll move back to the Northeast. And now it's 15, 16 years later, and here I am, and I couldn't imagine being anywhere else. This has really just been the perfect fit. So I think the lesson learned from that, and maybe the message I should give to senior and chief residents looking at where they're going to be and thinking about what careers they want to pursue, is don't shut that door and think that you could never live in a certain part of the country. Really consider all your opportunities, because you may be surprised. Things may turn out to be much more of a perfect fit than you think going into it.
Now, kind of taking us through that journey, how'd you end up becoming chair of the program?
So, early on in my career, I really focused on my career and my career goals and my aspirations. I said earlier that I had always dreamed of being a clinician scientist. And so I spent a lot of effort and time and attention towards building my research laboratory, training graduate students, and advancing my science and getting grants and publishing papers, and as well as starting my clinical practice and building my clinical practice and performing surgery and endovascular procedures. Along the way, I decided to get an MBA, and I went to the University of Florida Business School, and that was really kind of moving out of my comfort zone and doing something completely different and learning something that was completely foreign and different to what I had spent most of my life preparing and developing. And my mentors had always told me, think of your career as 10-year blocks. Focus on something and developing something over 10 years. And then after 10 years, look back at what you've done and think about what you want to do for the next 10 years. So at about that time, I was in business school. I'd really devoted the first 10 years of my career towards building my own practice, my own lab, and I really spent some insightful moments looking back on that and thinking, what do I want to do in the next 10 years? And what I had decided, what I really wanted to do was refocus my attention on helping build the careers of my other faculty. And so really shifting that focus away from my career and doing things for me to doing something to help others and help other faculty develop their careers, what I could do as a chair to help my faculty in achieving their goals and advancing the mission of our department. And so that was when I really started thinking about becoming a chair. And then I looked at various chair positions, and the way things kind of worked out and timing and everything, it happened that Bill Friedman, who had been chair for 20 years at the University of Florida, decided to step down as chair, and this opportunity opened up. And fortunately, I was able to obtain this position.
So throughout your career, what would you say were some of the keys to your success that shaped those early days as you climbed the ranks in the academic world?
I think that being persistent, we all face failure, obstacles, challenges, difficult times. And I think many of us suffer from what we call imposter syndrome. And so I was confident. I knew that I had received good training. I knew I was capable, but we always have self-doubt, and particularly in starting a research laboratory. For every grant that I received, there was probably 100 grants I applied for and didn't get, or for every paper that I published, there was 100 papers I submitted that didn't get published. And then, when we take care of patients, sometimes there is that complication or that unexpected outcome, and it can really fill you with self-doubt. And so even in the face of that, I think I was persistent. I wanted to get better. I wanted to have a research career. I wanted to improve in my treatment of patients. And so I think it was probably just persistence.
So as a chair of the program, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Uh, my advice would be to have an idea of what kind of job or what kind of career will make you happy, satisfied, and which would be fulfilling. And part of that is not just kind of the big picture kind of vision or dream, but also just your day-to-day life. When that alarm clock wakes you up in the morning and you have to roll out of bed and go to work, I'm extremely lucky. And every morning when that alarm clock goes off, I am excited and happy to go to work. I'm looking forward to the day. And that's going to be different for everyone, every individual, but you want to be able to have that job, that environment, partners, colleagues that you just really look forward to going to work. And when you're at work, you're having fun and you're doing meaningful work and you feel fulfilled and satisfied and you have dreams and goals to pursue. But I also would say keep an open mind, like my example, where I didn't really think or imagine that I would be in Gainesville, Florida, and then it turned out just to be just an incredible place for me and a perfect fit for me and my family. Consider all these opportunities, and you may be surprised, like I was, with how things turn out.
Now in 2020 and still here in 2021, we're still dealing with the issues of the pandemic. So what advice do you have for the graduating class regarding their networking and outreaching process in a virtual world?
Yeah, I think this is really tough. I think I myself had never used Zoom or didn't know anything about Zoom before this pandemic, and now Zoom is just a essential part of my everyday work. And I think, fortunately, most of us are all accustomed to Zoom now, and so. And I've interviewed and recruited candidates for positions here at UF using Zoom. And so I think the preparation is probably going to be the same. You just have this added technological aspect to it that you need to do things by Zoom. One of the disadvantages, I suppose, is like I said, you want to find a place where it's a good fit and you'll feel like you'll wake up and go to work and be happy to go to work. I think probably you would miss out on some of that if you don't make an actual visit to the place. So that necessitates doing as much research into a place as you can, and making phone calls and talking to as many people as you can, and really trying to find out what it's like at that place you're looking at and considering.
Now, on that topic, as a chair of the program, what are you looking for in someone as far as a spot for the residency spots or for a fellowship spot?
Yeah, so for residency, we're really looking for candidates who obviously are bright, hardworking, and I think by the time they make it and are offered to an interview with us, they all have the board scores and the grades and the accomplishments to be successful and be highly sought after by any program in the country. So I think that what differentiates the successful residents from the residents that have difficulty or have a challenging time in residency are perhaps persistence, what Angela Duckworth has studied and written about, grit, really just having that passion and the persistence despite failure and difficult times. And we all know, all of us went through residency. Residency is tough. you're definitely going to have failure and challenges and difficulties in residency. But I think the residents that do really well are the ones that have that grit and that passion and persistence to make it through and tackle each day with that grit and perseverance. For faculty candidates, it's a little more tricky because in a department, we have specialists who have their niche or their subspecialty in neurosurgery. And we can't, if we have a certain number of neurosurgeons specializing in, let's say, functional neurosurgery, we just can't keep hiring more and more neurosurgeons that do functional neurosurgery. It's my job as chair to figure out how many of those faculty specialists that we need. And so when we're looking at faculty candidates, it's oftentimes we have a certain niche that we're looking for. We're looking for another brain tumor neurosurgeon, or we're looking for another cerebrovascular neurosurgeon. And then one of my visions and goals for the department here at the University of Florida is I really want our department to be a leading academic research department. And so what I'm particularly looking for are faculty candidates who are clinician scientists and have that aspiration to do research and move the field forward.
Now, switching gears, as the president of CNS, what type of resources and educational platforms are you providing for the next generation of neurosurgeons?
I'm glad you asked that, Matt. You know, the CNS really views itself as the leading educational organization in neurosurgery and has really built a platform of providing educational content to our members as well as neurosurgeons and anyone taking care of neurosurgical and neurological patients worldwide. 2020, obviously, with the COVID-19 pandemic, really was an unprecedented challenge. And I think the CNS really rose to that challenge and tackled educational content by providing virtual educational content and established many educational series, including virtual visiting professorships, town hall meetings for medical students and residents, webinars. And so I'm really proud of what the CNS has done in providing virtual educational content to our residents and medical students. I just recently received an email unsolicited from a neurosurgeon in Brunei who sent an email thanking the CNS for providing virtual educational content because neurosurgeons are not able to travel now and attend courses or attend meetings. And she was really grateful and thanked the CNS for continuing to provide that educational content now in a virtual platform. And despite all these advances that the CNS has provided in virtual educational content, I think all of us really do miss the in-person experience of attending an in-person course or an in-person meeting. Many of us have not attended a meeting in over a year because of the global pandemic. And so I think all of us are really looking forward to the 2021 CNS annual meeting, which is taking place in Austin, Texas, October 16th to 20th. In fact, Matt, you're going to be participating in that meeting and giving a talk geared towards residents and chief residents. So I think that will be a huge event for many of us. It will likely be the first time many of us will attend an in-person meeting since this pandemic has started. And so the CNS is doing everything to make this truly a special event, a special meeting for everyone. And we're all very excited. We're all looking forward to it. I know, Matt, you're looking forward to participating in that meeting.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.